Hello, and thank you for watching this video abstract as an introduction to the case report titled Physical Therapy in the Management of Recurrent Urinary Tract Infections, a case report. My name is Kate Devine, and I'm the primary author on the manuscript. So first, I wanted to start with a little story of how this case came to fruition. So I had given a community talk on pelvic health and physical therapy's role in pelvic health, and I had a woman come up to me at the end of the talk to ask a few questions. And she was telling me that she had a 10-year history of recurrent uncomplicated UTI and was very concerned about being on antibiotics off and on and the negative effects of the antibiotics. And she also expressed the social and emotional impact that these symptoms were having on her life. And so I encouraged her to talk to her primary care doctor and obtain a script for physical therapy to come see me. And she ended up in my office 2 weeks later. The purpose of this case report was to describe the PT management of a 50-year-old female with this 10-year history of uncomplicated UTI and stress incontinence. And based on her history, I hypothesized that she could have an underlying pelvic floor dysfunction that was contributing to dysfunctional and ineffective voiding, and therefore that could have played a role to predispose her to developing a recurrent infection. I saw the patient for 6 visits over a 6-week period, and we focused on patient education, pelvic floor muscle retraining with surface EMG biofeedback, and neuromuscular electrical internal stimulation, as well as bladder retraining and therapeutic exercise. She had very positive and favorable outcomes. Current clinical practice guidelines recommend and favor conservative treatment over the medical management of recurrent uncomplicated UTIs. However, antibiotics are continually being overprescribed for the management of UTI despite these current clinical practice guidelines. I encourage the readers to consider a few questions as they read through this case report. First, why are PTs not being utilized as healthcare providers that can provide conservative management for recurrent UTIs? Are PTs the appropriate healthcare providers to act as a first line of defense against these recurrent UTIs? And how do we bridge this gap clinically? I look forward to future discussions and future research in this area. Thank you.